Hello everyone! Welcome back to my channel. Today I am going to discuss on a most crucial topic that's the common symptoms of HIV in women's. HIV human immunodeficiency virus continues to affect millions worldwide. It's more than just a medical condition, it's a deeply personal journey for those living with it. While much attention is given to general HIV symptoms, did you know that women often experience unique symptoms that can differ from men? These signs may appear subtle, evolve slowly, or be easily confused with other health conditions. In this video, we'll take an in-depth look at 10 common HIV symptoms in women, offering an exhaustive explanation of what they are, why they occur, and what you can do to protect your health. Let's dive in. 1. Flu-like symptoms or acute retroviral syndrome. The earliest stage of HIV is called acute retroviral syndrome. This stage occurs within 2 to 4 weeks after exposure to the virus and is marked by flu-like symptoms as the immune system launches an aggressive response to fight the virus. These symptoms often mimic a seasonal illness, making them easy to overlook. High fever, often exceeding 100 degrees Fahrenheit. Persistent chills alternating with episodes of sweating. Sore throat that doesn't respond to typical remedies. Intense muscle and joint pain that feels more debilitating than a regular flu. Severe headaches. Fatigue, leaving you drained even after adequate rest. While these symptoms typically subside within 1 or 2 weeks, they are an important indicator of HIV at its earliest stage. Why this happens? When HIV enters the body, it infects immune cells such as CD4 T cells and multiplies rapidly. The immune system detects this and triggers inflammation to fight the infection. This battle between the virus and your immune system manifests as flu-like symptoms. Key takeaway: if you've engaged in unprotected sex or any high-risk activity recently and experienced these symptoms, consult a doctor immediately and get tested. Early detection can make a world of difference in managing the virus. 2. Swollen lymph nodes. Lymph nodes are small, bean-shaped glands located throughout your body, including the neck, armpits, and groin. They play a critical role in your immune system by filtering out harmful invaders like viruses and bacteria. In women with HIV, swollen lymph nodes are one of the earliest physical signs of the virus's presence. These nodes may feel tender to the touch, firm or rubbery in texture, noticeably enlarged, even if not painful. Swelling can persist for weeks or even months, depending on the body's immune response to HIV. Why this happens? HIV places immense stress on your immune system. The lymph nodes, which act as hubs for immune activity, become inflamed as they attempt to contain the virus and other pathogens. Key takeaway: if you notice persistent swelling in your lymph nodes, especially in combination with other symptoms, consult your healthcare provider. They may recommend diagnostic tests, including an HIV test. 3. Persistent fatigue. Chronic fatigue is more than just feeling tired after a long day. For women with HIV, this type of exhaustion is constant and unrelenting, affecting both physical and mental stamina. This symptom can manifest as feeling physically weak even after a full night's sleep, a lack of energy to perform routine tasks, difficulty concentrating or maintaining focus, commonly referred to as brain fog. Fatigue in HIV is often compounded by other factors such as anemia, depression, or opportunistic infections that the immune system struggles to control. Why this happens? HIV causes persistent inflammation and depletes your body's resources as it fights to combat the virus. Over time, this battle takes a toll on your energy reserves, leaving you perpetually drained. Key takeaway: unexplained fatigue lasting more than a few weeks should never be ignored. Consult a doctor for a full evaluation. 4. Recurrent yeast infections. Yeast infections, caused by an overgrowth of the fungus Candida, are common among women. However, for women living with HIV, these infections occur more frequently, are more severe, and may become resistant to typical treatments. Symptoms of a vaginal yeast infection include persistent itching and burning in the vaginal area, a thick, white discharge with a cottage cheese-like appearance, painful urination or intercourse, redness or swelling of the vulva. These infections are harder to manage in women with HIV due to a weakened immune system that cannot keep fungal growth under control. Why this happens? A compromised immune system is less effective at regulating the natural balance of bacteria and yeast in the body, allowing candida to overgrow. Key takeaway: if you experience frequent or stubborn yeast infections, seek medical advice and consider testing for underlying conditions like HIV. 5. Irregular menstrual cycles. HIV can cause hormonal imbalances, leading to disruptions in your menstrual cycle. Women may experience missed or irregular periods, heavier or lighter than normal bleeding, shortened or lengthened cycle durations. These irregularities are often exacerbated by factors such as stress, weight changes, anemia, or side effects from HIV medications. Why this happens? Chronic illness and the body's immune response to HIV can disrupt hormone production, particularly estrogen and progesterone, which regulate menstruation. Key takeaway: track your cycles carefully and share any irregularities with your doctor, as they could indicate underlying issues. 6. Skin rashes and lesions. Skin problems are often an early and ongoing symptom of HIV, and women with HIV may develop itchy, red rashes on the face, chest, or arms, dry, flaky patches of skin, painful lesions or sores, especially in advanced stages. These skin conditions can result from the virus itself or opportunistic infections like fungal or bacterial infections. Some rashes may also be side effects of HIV medications. Why it happens? A weakened immune system leaves the skin vulnerable to infections and inflammation. Actionable tip: don't ignore persistent or worsening skin conditions. Dermatological issues can often provide clues about underlying health problems. 7. Night sweats. Night sweats are another common symptom of HIV. These episodes are intense, leaving you soaked despite a cool room temperature. Night sweats are caused by the body's inflammatory response to the virus, opportunistic infections like tuberculosis or lymphoma in advanced HIV cases. Actionable tip: record how often you experience night sweats and share this information with your doctor. Persistent night sweats require immediate medical evaluation. 8. Unexplained weight loss. Significant, unintentional weight loss is a red flag for advanced HIV, often referred to as wasting syndrome. This occurs when the body is unable to absorb nutrients properly due to chronic diarrhea, appetite loss, or opportunistic infections. Women may notice a rapid loss of fat and muscle, leaving them feeling weaker and more vulnerable to illnesses. Actionable tip: sudden weight loss should never be ignored. Speak to a doctor for a full assessment and to explore possible causes, including HIV. 9. Persistent cough or shortness of breath. HIV can make women more susceptible to respiratory infections like pneumonia or tuberculosis. A persistent cough, wheezing, or shortness of breath may indicate that the virus is weakening your lungs. These symptoms can progress if left untreated, especially as the immune system continues to decline. Actionable tip: don't ignore respiratory symptoms that last for weeks. Seek medical attention promptly for a proper diagnosis. 10. Pelvic inflammatory disease. Pelvic inflammatory disease is a serious infection of the female reproductive organs. Women with HIV are more likely to experience recurrent or severe cases of PID due to a weakened immune system. Symptoms of PID include severe lower abdominal pain, a fever, unusual vaginal discharge, pain during sex or urination. Untreated PID can lead to infertility, chronic pelvic pain, and other complications. Actionable tip: if you experience symptoms of PID, seek medical care immediately to prevent lasting damage. Women visiting healthcare clinics, receiving support, and engaging in healthy lifestyle activities like yoga or walking. HIV symptoms in women can be subtle, varied, and easily mistaken for other health issues. By learning to recognize these signs, you can take proactive steps toward diagnosis and treatment. If you or someone you know experiences any of these symptoms, seek medical advice immediately. Remember, early detection can save lives. Thank you for watching this detailed guide. Don't forget to like, share, and subscribe to our channel for more informative health content. Take care and prioritize your well-being.